Yat shikado shidne ado kuja hanada siyo gizi damodo digijibone kodo ya hanet lini hije nail I do sodazin lini be nail I ko ani te ein hit sodazin da holodo as ein hi da ho ko sodilzin shido le kodo shikado shidne kodo jondo le na hasan shama yadelhil Zillistan Twistan Chalhiel Hayol Kalna de Tsui Adokon Halchelki Halchewan Tradedin Ani Sa Anna Rebik a Hojon or Trile Goni Yajan away Needle Di Binibi Conje Na I Kanton Tana Dilsen A Quije Kodo Todilsen do Na Inika Adon Nihuman Hassan Lini Kon Yadelhil the Indine Danol Lini that Ade Kon di Binibi Kon he lead or let so the Asla Ani Dinon he ket Adon Lane he seat Aja home Naha Nahol Yard or let he cannot eat or let Naha Nanchet or let Hashine La home Nihitene and Lini Pejay Dastel Ado Kon Yinni Dodge Enna Bihi Kre the cousin Tanas it's at the Holieni dots eat ego hon here in at home. Be right to yadat yen hisnel a quandala, which a haini no in hin la dole do in hinsen dole. Nasco net nidge yat ehon nani kedole, nasco net nidge yat ehon his nahast adole. All when you a con ni ran the hollow. Adon he con that the click ni honesh gishnas tra. Ado con his test ni he tro. Nas kahon yat ehon ba nahi katole. Ado con hinash yat ehon ba na the huliadole o you dance on halchinin nagas zani til ke dan lini con yat eho. Bena de yel katole hon. Na nishin lini con yat eho na de descendole. Ado con pandal nishido yandaha ani con yat eho hon hinata. Zolo nitolon ha nin gladole. Ha ishi bikachana ni zini kon hilek ein ladole asla ansitino. Ado hon hidenetil case twisani dan lini kon ta isai. Pero betrahiata hot ehtole hon. Ha ishi bebeln da hoilni kon janoik iti tadole ado ye nan tindole. Ado kon ha halna idan lini kon halchinin hito ken hinalike. Yat ehon nada kedole. Ado kon hi yajin hi awe hon ha shine la kon da istranle ado ultra altron de illa pero ya betrahiata hot etole nas kon net nije ek in de dadole na nishbi yisi ultra bi yisi ado tlat so da dan le hon ya ek pataz dole ado ha shine la kon hitne en lini kon betrata hones gido ya tadili hon adije Betranda hon azole yat ehon nada kedole anilso. Adon hinat ahn lini alton til de hon besh mahasa ane ado kontrat nazil dan lini hon. Tinehesti bebe dabet ojini kon keya benat dan lina tloshi benat dan le alton yat ehon da kedon hitine. Njuno hon benata huinit dole hon naskone nije. Kontere eitodizin lini ahon shende behanana sidole belah ishlai ba o ishlai hon up in benhina da hol nidole di in the ne kontere eitodizin lini hon enanilia dole adile ben hijra wajana hasling. At this time we'll give the floor to Honorable President Shana Jonathan Nez. You have the floor.
Thank you, Dr. Fowler, for the prayer. A beautiful prayer this morning. Start our day. So the Zen behadasot zi binda jaishi be adanit edo lehtich do naso. Ado kodohanet nhichi kondeli. Tuesday and Thursday is gonna ado o hihe dan hinatigi do da isinal tsagi. Ado haneshi Tlashin hilpeda hazan. Le Washington there. Di ze nihiche kodalia ya hastra tsada do bela binda khegi 16 and over. Jo hot out ze naha alia late December ya da do di jinj. Ako ani le Washington de ya nakhalchin na kids ata don le shlats ata binda khegi at apa alia hot abella azli. So at the zel innen das negi de nabiki apaka di chilla ya kon chinaba adat edo lesako di a yedago clinic do hospitals and das neligia which she had ne di chinda zaba ad da do got da bedol kidolles ako yes she din da initial net Friday aro the more yajigun ya adat edosa so scout she teacher that's a scout that's a job and do lefty the more yajigun hela di zel in das neligi adat edoles ishin hichashana dal adel net or lef shikiroshin di nakits ata tosh la zata an halchin bindach egi ishi baat edoles a konde tlaila DJ la adal ne to adal yashi kudo hanen hijo dalia so dana e bela asli so DJ shi la ko ze de kagi do zel in agenda de shi yidao ka do le khal chin shi ko bada tse shi do le as ka do unda initial do the more yajuna shin kon khal chin la na bada nos bada dotse da nos senegin kat an khaadat ako nihikodo khal chin yego da iltragi do bisschen del neshigi iskini khato di egi bandate so le Monday je shla nezna tin la la bada dotse da di no hot an da huita so nihin khasla ko amada je che masan la no se no khachin da halonigi ishi ya balana nossen nihido balana da nitsen bada dotse so hot ya di nasnigi na cha hadolto da di ne ko de nebiki apaka DJ ya dana do DJ sasha na ki jinda anneshon do dana tage jinda anneshon ya na din na din hik eni nabda dolna na din el kit alachi hot ashin bida dolna na din enel aro san hitsa ajitenna di zegi shi benina so khabansis keshik enosleni di zegi yego bikeje na neshti de kosenskagi na hast eitsa da ja benina ekon nike jo ba deni kid ashon khalchindo ba ba da dots da di no ya ako lashi na di kid ko DJ ya zel indan lenigi shi ya kon zel indan lenigi shi nike hada zito le doctor do dan lenigi zel indan lenigi aron hina adik kitchi da halongo kodo nike ashchane de le to le Dr. Jim Navajo Department of Health was aj edo nike hat zito le ishi kun bela da azlingi do kun da nishigi nebike pakao Aro Washington, it's East Bahia, Navajo area, so Captain Brian Johnson. Ado Trapijipka. Aro Zel ni Zel in Aja da Iltragi, it's East Bahia, Ado Aja was Aja do Tlanija Hadatzi. Dr. Eric Ritchie, a Navajo area IHS. Dr. Deanna Hu, Le Tudnes Disdan. Dr. Michael Tutt, Iltra do Dr. Salim, Kadle Tsehutsoi Medical Center, Ajinal Nish, Edon Hitchahatsi, teacher, Ado Kudo, Sister Hitchahatsi, Dr. Fowler, Ashin de Nick Etcher, Hitcher. Ashton ileto les contrato de nek etchia daskita de Ghana and dal shigi ishinka tral to des teacher so ishin o bansda kesto des do hanet do hinadi kid halong go ishin kon comment that egi bit the hasnet do des do shikeno slini are chinno slini named da kregi aro di computers and speda hazenigi Ni massa ni chain ni nala ni keda leni do bilagana ketchup yada kegi do jo bespeda hazinigi edo ba ashona ba hatra da hasna ashona di chinga ba ze ba yagi. So Eli, if you can go to the first slide. And good morning to everybody that is joining us. We have a lineup. It might be a little lengthy because of the approval. The U.S. Centers for Disease Control and Prevention recommended the use of the Pfizer vaccine for the 12 to 15-year-olds. And I just mentioned this in Navajo earlier. The 12 to 15-year-old adolescent population. And this happened yesterday, Wednesday, which was also approved by the FDA on Monday. Several healthcare facilities, the facilities on the Navajo Nation will begin vaccinating as soon as today. Some may be doing it now. So if you are interested, parents and grandparents and guardians, that you want your 12 to 15-year-old vaccinated, call your local healthcare facility. Since this announcement was new, some may not be offering it, but I believe most will be offering these today. But I'm sure the full blitzes will start happening. When I say blitzes, that's a lot of people going through the lines starting Friday and Saturday. And I did encourage the healthcare facilities to be open on Saturday for those that are maybe coming from afar. So those facilities begin, and this is only for Pfizer. Pfizer was the only vaccine that was given approval. So not Moderna, not J&J for 12 to 15 years, just Pfizer. And you need 2 shots for Pfizer. And Friday, we're still working on the Friday, Saturday schedule where we're going to get input from updates from the IHS and 638 facilities so we can have a good schedule for you. Rather than bits and pieces all over the place, flyers here and there, we want to have all of it into maybe a 1 to 2 pager for you all to know. And when I say 12 to 15 years, yes, it's starting to be open, but adults can still come and get their vaccine at the same time too. It's not just only for 12 to 15. It's for, let me just say it's 12 plus, right? 12 plus all the way into the senior years. So if you're going to bring your child to get vaccinated and you're not vaccinated, you can get vaccinated. Our goal, ladies and gentlemen, our goal in these next 3 days, Thursday today, Friday tomorrow, Saturday on the weekend, is to try to get close to 3,000 to 5,000 of our Navajo youth as well as our adults vaccinated. That's our goal. You got to have a goal, right? Let's get 5,000 people vaccinated these next 3 days. More of that is probably going to be our younger individuals. And again, it's up to you, but you can see by the numbers that I mentioned, 30,662 people have caught the virus. 29,265 have recovered. 1,285 people we've lost because of COVID. 20 positive cases in 24 hours from Tuesday to Wednesday yesterday. So these are 24 hours, 20 new cases, 0 deaths. And I truly believe, and I think all the healthcare professionals also would say that it's because of the vaccine. And we encourage our young people to get vaccinated. Matter of fact, our 13-year-old will be getting vaccinated today as well. I encourage, and he's excited to get vaccinated. I mean, I think young people are excited to get vaccinated so they can go back to school. And this is one way that we can transition to reopen our schools. The second slide there is in regards to the second slide there is the progression of the virus since day one. Something that we share with you almost every meeting so that you are well informed of what's happening since the start of the pandemic. And so just we're at an all-time low, and we again appreciate families having gatherings safely. We had Mother's Day, Happy Mother's Day, belated Mother's Day for some that didn't see our press release about Happy Mother's Day. And I'm very confident that you all had a safe Mother's Day weekend, following the protocols, staying safe, washing hands, wearing masks, those things got to continue here on Navajo. If you go to the next slide, we have a comparison of the states throughout the country. And if you can see it, it might be a little small, but the top one is Michigan. The most COVID positive cases in the last 7 days. And the second one there, and it's a red line, is Colorado. Colorado has seen a increase in cases lately, and it looks like it's been flattening out there in Colorado. And so if you go down to the next red, right, the midway part of it, that's Utah. And Utah, after or below Utah is New Mexico. Then right after New Mexico is Arizona. And then the yellow is the Navajo Nation. That's that slide. And the next slide, we also want to let you get an update. And I shared the same slide on Tuesday. This is as of May 10th. That's the Navajo Nation COVID-19 SARS strain surveillance. There's different strains out there, variants as they call it. And if you look at the slide there, you see B117 is the UK variant. And then that's the top variant. So if you go through, Chinle has 6 that have been identified, 8 in Gallup, 3 in Shiprock, 4 in Tuba City. 21 overall with the UK variant that has been identified here on the Navajo Nation. Although the next one, B1351, is the South African variant, which we don't have the South African variant identified here on the Navajo Nation. The B1 is the Brazilian variant. If you go through the chart there, there's only been one identified in the Utah Navajo health systems. The last one there at the bottom of the chart, B1 427 and 429 is the California variant. 1 in Chinle, 3 in Gallup, 5 in Kayenta, 5 in Shiprock, 3 in Tuba City. 17 of the California variants cases have been identified here on the Navajo Nation. What does this mean? This means that the variants are 2 of them, at least 3, if you count Utah, are here on the Navajo Nation. But the reason why I truly believe, once again, that it's not spreading is because of our contact tracers that are helping stop and slow down these types of spreads. And the vaccine scientifically shows that if you have the shots, it can push back on all these variants. And of course, you can still catch the virus. But if you were to catch the virus, and we saw a case study in Tuba City on that you won't get sick severely, and you will transition quicker out of that sickness, and you get isolated. So that's why for us, we're saying it's very important to be vaccinated. The next slide there gives you the overall total doses and distribution. What we receive is 247,165 doses, and that includes Pfizer, Moderna, and J&J. We are going to be asking, and I'm sure they know that we need more because we're giving more of it out. We need more from the feds. We need more from the Indian Health Services. So what we have been able to give to the citizens is 228,229 of those 247,000 plus, and that's 92.3%. So that means right now on the Navajo Nation, 7.7% of what we receive that's all we have. So of course we're going to have to replenish, especially the Pfizer. Number of people receiving 2 doses, fully vaccinated, is 101,671. And that's as of May 12th, 2021. Today, by the end of the day, I'm hoping we will give you a percentage of how many of our Navajo residents, people living actually on the Navajo Nation, the adult population, 16 and over, have been fully vaccinated. I know we're over the 70% mark, and we're wanting to get a specific, because I did say, excuse me, I did say that once we get to 75%, I think it's time for us to regroup, reevaluate our visitors coming into the Navajo Nation. We're in the midst of tourist season, and our visitors are bring dollars into our households. But we got to do it safe. I'm going to still have to say that we have to wear our mask. If you're a jewelry seller or you're a tour company out there, even though we open the nation back up to our visitors, you're going to still have to be wearing your mask. But at least, we protect ourselves, we protect our visitors as well. That's how it works, ladies and gentlemen. So with that said, there's going to be a lot more discussion on the 12 to 15-year-old vaccination events happening. I appreciate everybody for their attentiveness through these types of town hall meetings. There's a lot of information. Please share it with the Navajo people. We love you. We appreciate you. We just want you to be safe, and we'll get through this pandemic. You have done an outstanding job, Navajo people, and all the praise to God for helping us here. And appreciate the prayers of everyone, including our vice president, praying with the National Day of Prayer. God is hearing our words and giving us favor, I truly believe. So continue to pray, and we will get through this together, this pandemic. God bless you. God bless our great Navajo Nation. I'm going to turn the time over to our Vice President, Mr. Myron Lizer. Take it away.
All righty. Thank you, Mr. President. Thank you for those updates. And sure as things change and morph into new updates, new news, we are ready, and I appreciate our president's leadership in everything that he does here as we are on the eve, I guess, of all the 12 to 15-year-olds receiving their vaccine. A lot of them wanting to participate and to contribute to our nation's. So we appreciate you. Thank you. Vice President Lizer here. Comanche Nishle, Tolhana Basistin, Comanche Deshache, Clash Deshanelli. It's good to be with you here on this May 13th COVID-19 Town Hall update. At some point, we'll have to rename it, and it will no longer be COVID-19 Town Hall update. Just maybe the executive branch on town hall update. So, but we appreciate you all. Thank you for viewing in here, all of our Facebook Live listeners, and all those that will be appearing in throughout the day as time permits. As we always do, thank you for the prayer from our Dr. Perphelia Fowler. Excellent prayer. We appreciate that. Thank you. Latest news on a large overall scale here. The White House will announce a new partnership with Uber and Lyft to make all rides to and from vaccination sites free until July 4th, per the administration officials. So this is abroad for your friends and family out in the metropolitan areas. Let them know that Uber and Lyft will be providing free destination trips to vaccination sites. So that's a great thing. News here in Arizona, reports of the state 7-day average here was held steady in the 600s to the 700s. If you remember, I've been given the updates here in Arizona, but it's been about that level for weeks. As you know, the state has over almost 6 million in population. So to have statewide totals around 600 to 700 is pretty good. And I think here shortly you'll be hearing an update from our health professionals here, giving us update on what that looks like in comparison to the Navajo Nation, which is pretty low. And so let's stay low. We want to be on the low end of this metric here, certainly. The state 7-day average for new reported COVID-19 cases was 696 as of Tuesday, which would be 2 days ago, compared with 716 2 weeks ago. So we do see a downward trend here, even at the statewide level. And so the average had reached an average of 9,800 in January. So this is according to state data. So, but we appreciate you all are part of that conglomerate, that number of cases coming down. So Arizona statewide, 871, 168 total year and 2 months in to this pandemic, with 544 new cases. Apache County, we have 9 new cases. So keep it up, Apache County. Navajo County, we have 8 new cases. So you see people are still being safe and remaining cautious. And Coconino County, rounding out our Tri-County area here in northeastern Arizona, with 2 new cases to report. New Mexico, the news in New Mexico, 60% of eligible New Mexicans have received their first COVID-19 vaccine. 48% of those eligible are fully vaccinated, and health officials estimate that the state could reach 60% by the end of June. As you know, our president and our health professionals have slated 75% as our goal to receive the vaccination, both of them, and or the single shot as well, 75%. So New Mexico is at 60%. Total cases in New Mexico, 196. San Juan County, 29 new cases. As you know, in our latest updates, San Juan County has been in the red. Their numbers are still pretty high. 29, I mean, in the grand scheme of things, throughout the time during this pandemic, 29 would be a good number, but in these, the lower numbers of the in our areas here, 29 is pretty high. So continue to be safe, maybe even limiting travel to this area here. McKinley County has 8 new cases there, so our neighbors there are doing well. And rounding out our third state here, Utah. Utahns are fully vaccinated as 13,602 vaccine doses administered in the 24 hours, totaling to 2.3 million doses. So the 1.3 million Utahns are fully vaccinated. New cases in the state there of Utah, 468 new cases there, bringing their total year in 2 months in 401,251. San Juan County there in southeastern Utah, our neighbors, 1,904. Looks like they have had 1 new case to report. And our own Utah Navajo Health System, they're reporting no new cases, still standing pat at 1,095. But we, leadership, President and I, and all of our cabinet and leaders and the health professionals all continue to say the same thing. Every Navajo that we have here on our land must work together to control and stem the spread of COVID-19. So please stay home. Again, the message will and does not change, especially if you are sick. So there's nothing new to report there. We're still maintaining the same messaging. Wear a mask and face covering in public and around areas, social distancing, avoiding large crowds. And that message needs to be hearkened out by us all, because we have the graduations, and you'll hear some updates on graduating and what the latest public health emergency order stipulates there for large gatherings for those. So just remain cautious again, avoid those. And should you find yourself celebrating the great accomplishments of a loved one at a graduation, then please relegate yourself to limited participation in the ensuing receptions and parties and the like. So we continue to advocate for all of our citizens to remain vigilant. So we appreciate you all and appreciate the prayers here, and President and I and First and Second Lady do join all of our leaders here praying for you all continually. So at this time, I'd like to bring up Dr. Jill Jim here, who is standing by to give us her updates as well. Again, we're all in this together, one for all for one. You all continue to be safe. We appreciate you, and we thank you for this time being able to give you updates here. So Dr. Jim, I see you are ready and fit and able. So thank you for your great leadership. Yeah. Ladies and gentlemen, Dr. Jill Jim, Executive Director, Navajo Department of Health.
Thank you, Vice President, for all your comments this morning. As usual, nice to just hear the perspective from your effort in order to keep everyone safe too. So yeah, on also to President Nez, Dr. Jill Jim Donna and the Shani A log on the Sean Kachini versus Chindo, Shane the Shado, the Fanada Sala, Ada not on the ice in the Shadow. It's Ispa, he and Jay Crab, get in she do creddy. It's Isa had the Shadon Nido, creddy all by Hanson, additionally creddy COVID-19 updates, the all creddy every week. Kwan hija han dates the is inado kwadi not only done lenido kwadi do shama Dr. Fowler kwan general kwadi nakha at khahel las do adon hija not so I do baken sana additional ado I don't beha odzigi kwadi a from the national and global perspective gashe belagana johatest there the cases and around the United States and globally is quite different. And so I think something that we always have to realize is when do we, as a Navajo Nation, prevent that third surge? And we are doing that. We are doing a very good job in preventing that third surge for the Navajo Nation, while the United States is on its third surge, but also some of those states have had their up and downs with numbers. And it's really interesting, and it might actually be correlated, or it is to some extent, the mitigation efforts that are in those states. We were warned a while back ago on lifting restrictions very quickly as a caution by Dr. Walensky with CDC. We also have here on the Navajo Nation maintain our position on some of the CDC guidelines that we definitely are not supporting. And I think that has served us well, because some of these CDC recommendations continually change. And I think for our population, we just need to keep our pulse on the understanding that our population here is quite different. We, to some extent, we are very different in regards to protecting our people a little bit more so, just only because we have a lot of our relatives have underlying health conditions. So that's one big factor, I think, has led to possibly the increase of cases for a long time, because those were one of the risk factors, is underlying health conditions. So we take our mitigation efforts a little bit more seriously, and might be a little bit longer to reopen up, but we are considering the safety of everyone. I know that outside the Navajo Nation, states have lifted restrictions, and how they trend is different than ours. So I just wanted to reiterate that even in the high cases in Michigan, at least they're going on a downward trajectory, which is a good sign that they've are at the downhill of their trajectory, which is a good sign just with COVID in general. So in Colorado, we know that other factors are at play, like the nursing facilities and schools and other areas. So I know on Navajo, we have made sure there is an effort on vaccinating almost everyone here and encouraging everyone to get vaccinated. So with that in mind, we will see numbers a little bit differently. So we just hope that the other states continue their efforts so that their numbers will go down. And I think that has been the national trend for a while as well. We also understand that other international countries have different circumstances. We also just pray for those nations to make sure that they work and keep their people safe and their numbers down too. So it seems like it's something that we didn't really ever consider before, but it is something that's beyond the Navajo Nation and beyond the United States and around the world, that we will just have to keep our prayers and thoughts for everyone to make sure that we keep our numbers down. And so we are all doing a good job in preventing that third surge, as I mentioned. So just making sure we're masking up indoors and outdoors and around others, and keeping our ourselves safe and our families and our relatives safe here on the Navajo Nation. No matter where you are, you can always take all the precaution that you need to, and just hoping that we continually keep the numbers down. I also just want to reiterate, I know the health professionals on the call today will speak to this, is just that the vaccines now are going to be available to a much younger age group. And we just want to encourage our grandmas and grandpas that the ice on him masandon hichedan lenido hinala sondon hinala chedan lenida do she belagana getchudat adedi that Kaishinta is not angi and Himasandon, Hichedan Lenido, and Himayajutan Nishi Opetahatosne. So just encouraging those that are listening to talk to your grandparents and about the vaccine. And because sometimes we have a lot of families, parents that work off the Navajo reservation, and in order to keep up with their income and their ability to survive. So sometimes the children are here with their grandparents, their nullies. So we just want to encourage those that are out there, either could be a cousin or an aunt that want to talk to your to the caregiver to make sure that these are available for kids now for 12 and up. So that would be one of my messages today, is making sure that we share the information with others, and each facility is going to have a different circumstance on their when their hours will be open. So check with their local health provider. And so understand that we all understand that their school sessions are still happening right now. Kids are still in school virtually, so find the time as a parent, or work with the hospital. I'm sure they'll have evening hours or either weekend hours to accommodate working parents and individuals to make sure kids get vaccinated. So just be aware that hopefully we can have time available for you, and also take those opportunities, especially on weekends if they're going to be available this weekend in those some of the communities as well. So there is a push, as President mentioned. We have set the bar for the entire country. We are probably one of the very highly vaccinated populations in the United States, and I just want to commend everyone for your effort in doing that. And we can also set the bar higher again by getting most of our kids vaccinated as well. So Ahot ashi at iso hadesto ihe Dyson agidi ebene naneto kwashe Captain Johnson from the Navajo area office. I will hand over time with him. He's a UCG member. All of these are members of our effort to keep COVID numbers low and also to keep people healthy. So Captain Johnson with the Navajo area office, take it away.
Okay, thank you, Dr. Jim. Again, it's good to be here, and certainly thank you and President Nez and Vice President Leiser for the comments this morning and the excellent involvement. And as we continue with our COVID-19 status reports and how we're going to make progress in moving forward. Again, this is Captain Brian Johnson. I serve as the acting Deputy Area Director for the Navajo Area Indian Health Service. I work with Miss Rosalind So as the Area Director. And of course, many of you know Dr. Loretta Christensen, there's our Chief Medical Officer. Just for your information, Dr. Christensen is presently assisting our headquarters in IHS. So we're thankful that she was willing to step up and assist our headquarters. And on this call, you'll also get to hear from our own Dr. Ritchie from the Chin Lee Service Unit, who's presently assisting covering those Chief Medical Officer responsibilities here in the Navajo Area Indian Health Service. And I wanted to start off by just mentioning that, yesterday, National Nurses Week came to an end. But I just wanted to mention one more time before we let that week go that we definitely appreciate our nurses across the healthcare system here on the Navajo Nation, whether you're working in Tuba City, Crown Point, Shiprock, Gallup, and others. We just appreciate those nurses who may be working in the ICU, maybe working on the floor, maybe working in the ED. A tremendous amount of work has gone into the COVID-19 pandemic, and we definitely appreciate them. And at the same time, I want to go ahead and also mention, back in March, we recognized Physicians Week. And again, I want to say thank you to the physicians that have joined here today. I know that Dr. Ritchie's online, again, from Chin Lee, and Dr. Dinah who has been just incredible in terms of her support as we've moved through the COVID-19 pandemic and just providing outstanding guidance. Oftentimes, I don't know that we know just how fortunate we are to have the quality of providers that we do. And I just want to challenge folks to, when you have an opportunity, certainly we need to make sure that we're all thanking our physicians and our nurses. If you're related to a nurse, if you know a physician, take a moment and thank them for what they've done, because these folks have worked long and hard hours and have really, really been a great support in making things happen. I just wanted to make a few high-level comments in my conversation here today, and then I'll turn it over to Dr. Ritchie for continued comments. But just for the general public, we do continue with the Indian Health Service and our tribal partners. We continue to work together with the Navajo Nation Health Command Operations Center on this COVID-19 pandemic, and we continue to certainly monitor and try to provide support, guidance, assistance to the extent that we can in terms of making sure our cases continue to trend downward. We need to make sure that we're doing the things that we can control, and we all know what many of those things are after going through this pandemic over a year now. So I just also wanted to mention that, you know, of course, with the Navajo Nation, the nation back on April 26th did issue the yellow phase in terms of our status here on the Navajo Nation, which did lessen some of the restrictions that we were seeing, but also maintained some of those restrictions so that we can continue to cautiously monitor and make well-informed decisions about how we're going to move forward. And I want to just take a moment, because it's not only important to thank the Navajo Nation leadership with the executive office, as well as the legislative with the Navajo Nation Council, but it's also important to just, again, I always like to say thank you to the Navajo people around the Navajo Nation. Again, whether you're north, south, east, or west, it's been certainly a team effort across Navajo Nation, which has been just outstanding. And as Dr. Jim mentioned, you know, nationally, the Navajo Nation is being looked at in terms of how this response was managed, was handled, and how we continue to move forward. And that's just a reflection of the leadership, whether we're talking about Navajo Nation or all of our physicians, our nurses helping us as we move forward. And so definitely a team effort. And I just want to thank everyone as we continue to see our cases drop down. Also, just wanted to mention real briefly, I always want to mention that we know that our case numbers are down at the moment, and again, we continue to monitor those. Sometimes we do come across a few upticks and in the numbers of cases, and we want to make sure that we're really monitoring that closely. I can't say enough how important it is for the system, our healthcare system across Navajo Nation, to be able to move quickly when we see cases develop and potential spread. And I want to say thank you to all of our contact tracers that are working throughout Navajo Nation, because that's one of the key components of making sure that we keep this virus suppressed. But we continue to do our COVID-19 testing, and we'll continue to do that, whether we're talking about tribal health organization sites or federal sites. That is continuing. So if you feel that you need or should or possibly should be tested, that service continues to be available across the continuum here on Navajo Nation. Again, it's been mentioned on this call about the announcement that came out yesterday, and I'll defer to the physicians to speak to that a little bit more. But we are excited that the emergency use authorization for 12 to 15-year-olds was issued yesterday, and we have been given the go-ahead by our Indian Health Service headquarters to move forward, and so that is in action. And we know that due to the guidance by our experts, our physicians leading the response at the service unit levels, we know that there's been preparation in advance. And I want to say thank you for that, because this is not something that was a surprise. This is something that our providers have been watching and making sure that we have a good direction whenever that was approved. So I'm not going to continue much further. I do want to allow some time for Drs. Ritchie and Dr. Hu and to provide their information. But I always just want to remind people that, you know, we do have the Pfizer vaccine, we do have the Moderna vaccine, and we do have Johnson & Johnson. And so we do have the 3 vaccines that do have the emergency use authorizations. But to be, to be specific, the best of these vaccines are just the one that's available to you, whether or not it's Pfizer, Moderna, or Johnson & Johnson. Any of these are something that we need to pursue, and we just continue to recommend. We're fortunate in the IHS system, and when I say IHS, Indian Healthcare System, I'm talking about tribal health programs and federal IHS programs. We're well over 1 million doses nationally. And that's really an outstanding testament to the dedication to get out and get people vaccinated. So we continue to appreciate that. So again, make sure, folks, although our case numbers are down, final message, let's make sure we're washing our hands, wearing our masks, and continue to watch our distance. And then our vaccinations through COVID-19 is perhaps the most beneficial thing you can do in terms of prevention. And that will help us reach community immunity so that we can protect ourselves, our families, and our elders. And with that, I'm going to turn to Dr. Ritchie to give him time to share what he would like today. Dr. Ritchie, please, you have the floor, sir.
Hi, good morning, everyone. Thank you, Captain Johnson, and thank you, Dr. Jim and President Nez, for having us on this town hall today. My name is Dr. Eric Ritchie. I'm the clinical director at Chinle Hospital in Chinle, Arizona. And today I'm serving in the acting capacity as the Navajo Area Indian Health Service CMO, while Dr. Christensen is detailed to IHS headquarters, as you heard Captain Johnson mention. I want to thank everyone for being on this call today. And I'm here to tell you that our Navajo Area Indian Health Service facilities are prepared and excited to begin offering COVID-19 vaccinations to children in the age 12 to 15-year-old age group. Most of our service units have been preparing for this moment for weeks. Our pediatricians are very excited to be involved in this effort, and you're going to see mass vaccination events being announced across our communities and in collaboration with local school programs to try to make sure that these vaccines are available. Our sites do have plenty of vaccine available, so I want to assure you that there's not a scarcity of vaccine. And I just want to encourage you to not only bring your children in to get vaccinated, but really to treat vaccination as a family affair. It really is important that we try to reach every single person that we can with a COVID-19 vaccination. And for those of you that may feel that personally you are not as high risk medically, maybe you're a younger individual or someone who doesn't have a lot of medical risk factors, it still is important for you to get vaccinated in order to protect all of us and for our community to get to a point where we can start to return to normal. Really, vaccination is a family event and it's a community event. It's up to all of us to do our part and get vaccinated in order to stop the spread of the coronavirus on Navajo and to help us get back to a more normal state of life. So we think about especially this adolescent population. It's now eligible for vaccination. We think about the things that they've had to miss out on in the past year, whether that's sporting events or graduations or other types of activities. The only way those things can come back is if all of us do our part to get vaccinated as soon as possible. When we look across Navajo Nation and we look at the individuals that have been vaccinated and those that still haven't gotten their first dose yet, a lot of them are younger individuals. They may be people less than age 35 and maybe those in the 20 to 30-year-old age group that haven't been vaccinated yet. And so again, I want to encourage you, even if you personally feel like you're someone that's healthy, that may not be at high risk, it's still really important for all of us to do our part and get vaccinated. As you heard President Nez mention, and Captain Johnson echoed this as well, we have vaccines available for all age groups. Even though today's call is about being able to expand these vaccines to children age 12 and up, we also have vaccines available for adults. And so all of our sites are vaccinating at all age groups and all priority levels at this point. So if you haven't gotten a vaccine yet, now is the time to come in and get vaccinated. Most of our facilities have plenty of vaccine available, and you're not really going to see a lot of long lines or waits either. So I really do want to encourage that. The other thing I want to take a moment to say, and Dr. Who's going to echo this a little bit as well, is that there's a major change in the way these vaccines can be administered that was recommended by ACIP and approved by the CDC, and that is that these vaccines can now be administered along with other routine immunizations. And that's very important, especially as we think about this age group for children and adolescents. So many of our children have put off coming in to see their pediatrician for routine well child care during this past year. So we know that a lot of our children are behind on routine immunizations that they would normally get in school or in preparation for attending during the school year. And so I want to encourage you, as you think about coming in to get vaccinated as a family, now is also a good time to think about taking care of some of those routine healthcare needs that maybe you've been putting off for the past year. And that includes getting up to date on all of your immunizations, not just COVID-19. I know our pediatricians are very excited about the opportunity to start seeing more children again and getting them up to date on their vaccinations. I do want to re-emphasize that these vaccines that are authorized for emergency use, all three of them, Pfizer, Moderna, and Johnson & Johnson, very safe, very effective at preventing the coronavirus. I have 2 young sons at home, and I just wish that they were older than 12 already so that I could bring them in to get vaccinated immediately. That's how confident I am in the safety of these vaccines. And so I do want to encourage you, if you have children that are older than age 12, please bring them in to get vaccinated, but also to bring in the whole family, get yourself vaccinated, take care of your own healthcare needs, because our facilities are fully open and here to serve you. And we really want to address all of the health needs of our population, including COVID-19. So with that, I'll stop and I'll turn the time over to Dr. Diana Hu at Tuba City Regional Health. Thank you, everyone, for allowing me to speak on this call.
Hello, hi. Hopefully you guys can hear me because I'm all the way over here in Tuba City with our bad internet. Good morning. My name is Diana Hu. I'm a pediatrician here in Tuba City. I've lived here I've had the privilege of working with the Navajo Nation and the Navajo children for about 35 years, basically my whole pediatric career after residency. I'm also the Navajo Area Immunization Coordinator, and so that's my involvement as both the pediatrician and the immunization coordinator with these efforts to get out COVID vaccines. Super proud of all of my colleagues and all of the partners on these calls that have really made the Navajo Nation sort of a shining example of how we did it right. We got slammed, we got hammered with lots of cases, but with this vaccination effort that's been going on since December, the Navajo people have been saved, many hospitalizations and many lives have been saved. And we're hoping that as we start to go down to vaccinate younger children, we can continue to protect everybody in the community, and we can continue to start looking at reopening, especially schools, because those of you that are parents, those of you that are grandparents, those of you that live in our communities know that our children need to be in school. That internet school was a stopgap measure to try and get our kids educated, but it's not successful for all families. It's very difficult for many families. So this effort not only will protect us from disease, but also will help us with reopening schools, which is a major priority for us in pediatrics. A lot of people are concerned that, well, hey, kids don't get that sick, and hey, I see these young people that got sick, maybe their family got sick, and they did fine. They didn't even have any symptoms. But let's talk about the magnitude of the problem. The problem nationally is over 22 million cases of coronavirus were diagnosed in 5 to 17-year-old children. And we think that is massively underdiagnosed because many children were asymptomatic, and in the very beginning, we didn't have enough tests to be able to be testing all of the children. We only could test people that were sick because it would make a decision about whether with their medical care. We know in the Navajo Nation that 1,600 kids have had a diagnosis of COVID. Once again, probably a very gross underestimate of the number of children who probably have been exposed and infected. We also know that especially with our multi-generational households and our multi-generational communities and our very close-knit families, that not only most of them were not the primary case in their family. They were infected by an adult, but then they also transmitted it to other people in their family. So that's why this remains an important situation for trying to protect as many people as we can. As Dr. Ritchie has mentioned, it's a family affair. It's a community affair. We know that less than 5% of the people who are under age 30 actually get admitted. So once again, it's not severe disease, but it's still contagious. And so that's why it's super important that we consider having our kids get immunized. And I want to once again reemphasize the safety data. And I'll be showing you a slide if I can figure out how to share my screen to show you the safety data that came out of the Pfizer trial and the FDA and was shown to the ACIP yesterday. So hopefully, if you guys can allow me to share my screen. I don't know who controls the sharing.
Edoshidne ado zail ine kodon hitch hata shady my dishkish nin shlon torich ini bashin tapaha etashe ado asche etashanale ado he nan hidi nidole kodo khan linin hitch honanalia ako ado di de kosantanas it's at tapedi nini nalnihi ado hashin toga atinal dogi jo kodo bana tahwilne ado ze bahazlin khatnini gi kodo o kono ua ze lini na hatalia na kidneza dino na dino te pite miliaje toba ana kidneza dino anast okone la ya ze lini na hatalia shik edo shidne ado kodo tsada an hinit ad ya dan hitne ko kodo she ze inin lini la ambana wil atole Dr. Who, you may now share your screen. Testing. We're still having a little bit of technical difficulties. Oyo quad on up into kiss and linear oyo ben hitch na hot ich edoshne. A condition nas manadole Dr. Who, we're unable to hear you. Kodo ya nasconet. We're now in the yellow status. Our numbers are going down. The Kusnats nast eight adapati nini yahut zagi konde na al COVID testing de line atibana alte ezel embetnahas ango ado ezel embetnahas ango da inni shik edo shidne ako kodo ezel inin lini ya nan ho kae ezel lini ashonde nakahata dolnil at opes nakahata at seta qad yati yise be lanche be wilne edi nakachni yajen lini na kitsat tato teka beta khayki qad ze bahazli to aj be la azli to be nasko net nije be ze inen lini nakachne ya de le ako khaisen tsati zel inen lini ye da desh nish ako kunna ashi khodit o nil kunna apaho khodit o nil edi kodo Dr. Richie Willianigi yan hasna chinli bil khahod zoje ako khano edi ultkhatn linij aje bil deil nishto ultkhatn linje anat ani dan lini jo kodo italate nat ani dan lini ultkhat bil khatahi zoje aje ye bil tatel nish ako kodoshi Kunna ashin khudato nil ado ol tkhapnas ango na tani dan lini jo ashin aja pasnahat ado ha na ashin Belko kota ben hilna don nin hilne ko at ende na khasa lashik eroshid ne khala dil chini yajin lini ya ze bahazle ban hilta hoja ko ni chini yaj khashine la asquisani lini yitado la betol na belakanik ajoy asymptomatic dilne yinda kego ado such not not es na akonde jo at nkhachinen lini is bahazlin ko nkhachinen lini ajanshi ahon wad nahaz tand satand apet dol nahot eto yeta akhalianko jo na apeni ahon wad satatan hitine akodi الشنن لني خيط خاديت دا أبج نهو تنت جو إيدو أزي بخل نطانه آدو بحطولني آدو أبت سيد دي خاشين سكن خالشن نو سلن لني إزي بحطالن تلا MMR ديشن آدو ميزو ربسن ربلا جو إيدو أتو بيبا أتسيو إيدو بخل نطو لش Allachont to nil eido baba honossen khashine la khachinen lini ba ta atsje inde yilka ekeden dat de nesli ko ebel abel by ba ot sekhani ko eido be hot ijna other hepatitis that delne immunization delne shik eido shitne hade dan khachinen yajin hi away and lo johin kidel ni johin khalle da jo old khadne de yo kid le ein de sheep e kedo that the netly e do sato be ba de do be ba not ot sich win no jo is in a bechoj dolne a konde el seigi edi is ba hazli ki Pfizer la aro Moderna aro Johnson and Johnson de at ekwato is in a dan e desne o et kedo shidne a ko at an na khachne na kids at the beta hedot da dan sei ad ze paholo o ni dog at e ben hilta huilne aro din khalchinen lini ani khati ta chehu ya ho ni le ani khashine la na khachine beta tol na ente juk at e ye go ya atza konde ze bahazli ke kwa pa he nitzen ako hon sagoshin kodo Nihilnata hosilna doleshik edo shidne ko och dast anko ado zeil inen lini aj yise ba ini lido aj hashin ko ze do it's isen lini ye in nihi ben nach kodo nihilche da ko edo ba he nitzen ado kwa o you atsko niche do sa anda hashi do edo Ashi inin hijetas tselin de yego ha inosti shikedo shidne kodo shinado shiyaj lini ya yastke ado tatso tatolsen so de zin edo ake da tahadne kon eze bahazli da ashkonde chide no edo naha atat ot se o yugo besna tahot ako an hi nit out eya eze lini ni hitotosni shamasaniya ni land إذا بادل صدا إذا خهل إيه أيات خجاب البانتك كيسو شدتولني خولية ناسكو بي يسونانا شتاحتو خولية جوغدات أيداش كدان شين ستويدو ساني أوت ين دان تيند شكيدو شدنا آدون هيتن إزايل إن هيتنا آدون هنات هيتنا نهيتشيدون هزي آبتاتا إزبالون داكي Nihila ta athan dakis ado hand sanitizer delnini be etatolsa. Jo edo yis ado hastra ades is an da ken hitran da chego ta huinas jo ati ahot ado sa as yugo an atani hago ta to ha hoto be ta hotia shikedo shidna ado o lgolo ado no chatle John Abe ta Hojilian ya at Eshikedo Shedine a Cohen Sakoshe Codon Hichahanane Zito not the Moj Aj Nahoji Joshi o kolla eget an hit yatki betchinto bezen de that is ba the shin should not need the dehona asa hasata aro sa yugo internet da holong go jo ho da tadisha ko eto be enna ho ila ko jo yohanana sa konda asa ho na sa ta ko ihe ha shik ero shne ade da isna to hanata se yo kizi ye go ta ho fiaro ta inosne ne zade ha ta kizi da ko shin ita ho sa hande ya at e ho na ha ta do ni hito ya at e ta ho fia ade na nishwike de no kato ultra ike na khahida ye go ta ho fia shik ero shne kul do le to na he shik ero shne hanata se yo kis di yin hil ta hallo do le.
Hello, everybody. Sorry I cut out with my usual internet inability to do anything. Just want to make sure, hopefully you guys can see this. This is once again the issue that shows why we should be giving this vaccination to children, especially to adolescents. If you can see this, you can see these are the trial data. This was analyzed by the CDC. A little bit complicated in terms of the lingo that has to do with statistical analysis, but probably more important for everyone to understand is that this vaccine was studied in over 2,000 kids between the ages of 12 and 15, which is nothing compared to basically the over 200 million adults that have now received it in our first rollout. But the thing to remember is that it was safe. It was very effective. You can see the vaccine efficacy estimate was 100% for symptomatic laboratory confirmed COVID disease. So as effective, if not better. We know that the actual laboratory data that shows the response of children 12 to 15 to the Pfizer vaccine was superior to that from people who are 18 to 25 years old. So we think that it's not only effective, but it's going to cause a good durable immune response. The one thing to remember is that about 11% of vaccine recipients did have some side effects. This is very similar and slightly lower than what we saw in the young adults. So it's not likely that kids are going to get very sick from this. Similar to those of you that already received your vaccination, you know that it's slightly higher risk to get a vaccine reaction with your second dose. But the majority of those reactions were basically fatigue, meaning feeling tired, a little bit of low-grade fever, and local reactions at the vaccination site. The one thing that's very important to know is that about 11% of people, so not that many, like 1 out of 10 of the kids had some reaction. There were a few cases, very few cases, but it was probably less than 1% that had a reaction called lymphadenopathy, which is swelling in the armpit lymph nodes or in the neck lymph nodes of the same side where they received the vaccine. We've actually seen that in other populations as well, in adults. It's pretty unusual, but we don't want people to get up if they notice this approximately 1 week after the vaccination that their child has some lumps in their neck or some lumps in their armpit on the same side where they received the vaccine. That is probably a vaccine reaction, and it does not. It will go away over the next 7 to 14 days. You can see that the critical benefits was felt to be very high, a type 1 analysis, and the certainty for critical harms is felt to be very, very low, which this is the data that we as physicians and scientists look at and say, this means that the risk benefit ratio for children to be vaccinated is quite high. And that's why giving it to 12 to 15-year-olds is going to help not only stop the spread of COVID, but especially help us reopen schools safely and stop the spread to older people who are more vulnerable. That said, once again, one thing that is very important, if you bring your child to come in to get vaccinated, or if you have grandma bring them in, please make sure that there is an adult that can consent. It can't be their 16-year-old big brother. It can't be a random friend. It needs to be, just as we have always had for our vaccination programs for children, that you can sign up, you can basically send in a note that says, I give permission for this person to drive my child in for this vaccination. But we can't just have the kids showing up on their own, because we have, they're not of the age to consent yet. Other things to remember is that if you have any questions, we have always been available to answer questions about vaccinations as a pediatric practice across the reservation. But we value your questions, and we really value that Navajo Nation has often had one of the highest vaccination rates, especially for teenagers. We had the highest vaccination rate in the entire Indian Health Service, which was higher than anywhere else in the entire country for adolescent vaccinations. And that's because we hope that you trust us and you have seen the effect of vaccinations on prevention of disease. And we hope the same thing will happen with this vaccination. So all the pediatric practices have all this information that they would like to share with you. But my last parting shot is that I tell the kids that I vaccinate, I thank them for being vaccinated. I tell them that they are now part of the cool kids, because the cool kids who are vaccinated are going to be protecting not only themselves, but their friends and their family, and they're going to be more likely to be able to do things like sports and have gatherings and go on field trips and learn in school. So they are the cool kids. So let's try and get all of our kids to be part of the cool kids and get them vaccinated as soon as you can. Thank you.
Thank you, Dr. Hu. I appreciate your presentation. Kodaya na holnet na kaalchinin hiyajet ketan lini na kitsata beda hedo deko beda heigi kodo ezet bahal yago khade belaganek a reaction delna oshin yo betrahanil kahat so betits in that denile and le ba o sedon le sata mo as lige ya bich aya koneta oyo ni cha gota adle be ze ya gita oyo ni cha gota ze etesnit et ajo chinin lini ze hot abenalnish a condito do hadate edan le na honkoton ni le to dit at his conjut na honkoton ni jolchin do at ado ad na alchine elchine na kit at bena hedon le strand at beda heko yato asa yato kata to amato je no sahita adabit yato ash kwa na tosen lini be lato shes abe to ataye lato shes ko be ba hot ida shin tot on haba honosen ado na adesh kit no so di ze embel na has ango aj lahotos ne khan na shin bel kho ahigi edot hot an hit an ye ishta na yitlado yisip adelni go ati khaydi la adelni jins no she at khaydi shin bedolni jo izek apata hollon ta ne ko khaisin ult le shik edo shid ne ati beltaho ahigi na khalchinaba ado nasa ya kon ye nanat edo le to ishi yo sa joln kitel ni jolli thalita nazn ni da donle an atahi jo hot ze delni lahob elchini yilta ne go ta jo na lato na khananas la amado je anal etche no se no lini shin bena kodo ya ze in etan hilne na alchini ka ze bahazli da adbel na da khedole Kwan tadole shik edo shidne na he ko jahana da se yo gizi da hollia ke ha